Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and we want to talk today about unlocking the potential for adult orthodontics. You know, expansion you can do it with Archwires. If you use these large Archwires, as long as you put the buccal root torque in and bring the teeth out. And I want to show this lady here that we did. I think she's 60 some odd years old, and there's just a world of adult orthodontics out there that's going untreated. Simply, many of them have them. They're fairly well off and they can afford orthodontics, and it should be charged by how much you're going to have to do, not just a general price for adult orthodontics. You just charge for whatever. You have to separate them up, or you have to do several things extra. Makes charges for that. It's just like fixing your car. You don't drive the car into the garage and say, how much do you fix a car? That's about the same way where we say, well, I just charge so much for orthodontics. That's ridiculous. So charge by what work has to be done on the case. And I'm going to go ahead and get started on this, and we'll show this lady's case where we expanded the mouth, and I think we used this Archwires. I didn't put a palatal separator in there or anything else at this age, and we used the large Archwire just to expand it. And I'm going to show the facial structure here, and you can see the crooked situation of the teeth. And then I will show the models, and the models are set up, you know, not, this is more or less a class 2 case. This bottom arch right here should be this two should be right in here, and so we don't want to bring them forward some, but we have to straighten this out up above, so it'll take that in. Now, looking at it from the front, you can see it's kind of lapped over, and these teeth are leading out, you know. These back some, you'll have to expand this as we bring this arch forward in the treatment. And you can do things with adults just like you do with young people. And it's ridiculous that I don't know how it got started that adult teeth wouldn't straighten, your bone wouldn't move. As long as you got a good root in the bone structure, you can move adult teeth just pretty much like you would young people. You just be gentle with it and open them up, and you can do whatever's necessary to straighten the teeth up on adults. Now let's go to the other side. Over here, you got a cross bite, and I think there's some other problems in here. Now this molar needs to move forward, too, on the bottom jaw, and to get them to hit in a class 1, what we call a class 1 relationship. Now looking at the arch, here you go up and you just got a narrow area in here, so we're going to want to widen this out up in this area right here. Makes a tremendous difference in the way the teeth smile and everything if your teeth fill out in the case. So we're lapped over up here, and we'll change that around, and I'll show the models when we get through here. And down on the bottom, it's the same thing. We got a narrow arch kind of coming together out here, so we want to expand it to match up with the upper arch. You have to kind of coordinate the two arches together. All right, here is the case. This is 99. That's after we had gone in and worked on it some. And let me run through these, and I will get to the end of it here pretty quick. All right, this is 99, and you can see the difference in here. I'm going to put the other arch beside it here in just a minute. And now on the bottom we finish this, and we just put a bar across the bottom teeth to make sure they stayed there. And here it was when we started. Now we're going to run through. This is the way the teeth look. That looks like the models a while ago. This is the starting thing. It was 1991. And I think this lady's about 60 some odd years old. Now here on the other side is 91 again. And the teeth are tilted back. Discoloration there, filling in the one, and the teeth are lined up like this. And now we get over here. Now here's the way we got there. We used arch wires to spread it out. I think I used a large arch wire to come in and catch it out, and I'd have to put some buccal root torque in it if you need to. If you're bringing it out very far, you need to do something that brings the roots of the teeth out also. All right, this is 92, then we started 91, and it didn't take all that long to change this whole thing for this lady. And there's the large arch wire. Now, this is a big wire. Now, when you design one, that comes on top of another arch wire in there that's got buccal root torque in it. And we've talked about that in several lectures in here. So you're bringing the root out at the same time. You have to put the rectangular arch on here. Let me just pull that up and draw that something. If somebody doesn't understand what we're talking about here, you'll have a molar tooth on the back, and the roots of it come up in here, and maybe if it's upward, have 3 roots on it coming in here. Now, you have to put a rectangular arch in here. You have a slot for it to fit in that's more narrow than that, but you have to bend this wire. If you're looking at my hand now, we would go back and we catch it behind the cuspid here and twist it at the other end and turn it down like this. Now when the arch wire gets back to this slot, the arch wire has the torque in it like that. Now it started out, like this, and we bent it out, and they got it to a permanent bend in it there. Now we come in and level this out right here and stick it into this slot. Now the wire was like this. You pull it over, put it in, and it's trying to do this to that tooth. And that will tend to rotate it around here and want to move the roots of the teeth out to the side. And then we've got this big arch wire over here that's expanded out. If you just put this on a tooth with an arch wire, it will make the crown go inside instead of going outside. It'll bend it that way because it's in the air and the roots are in the bone. So you bend this wire, put it in there, and it's doing this to the tooth. And then, it won't let the crown go this way. You put this large arch wire, and it pulls it over this way, over to the opposite side. You put all the lateral expansion you want in that big wire, and it holds it up there. So we end up expanding the whole tooth out there, whatever you do. In other words, it goes out, it takes the roots out as the crown goes out too. In other words, you don't want to tilt it, just kick the crown in. It would be reducing your air space up there, but that increases the air space for the tooth to get into. Now, I hope that explains that to some extent, and we'll go back and show you. We use these large arch wires. This might be an 036 wire or an 040 wire, and you can get all the expansion you want. And so when you put that positioning torque in here and put it on there, it's not going to bring that tooth in. It may want to go there, but that puts the force up on the root so that it goes out. You do not torque the teeth out with a round wire. It does the lateral expansion, so you have to have a rectangular wire underneath this. That would be underneath there. All right, that expands, and if you want it to expand in this area, have the wire kind of go out past these teeth, and it'll bring it out to the wire. In other words, you have one pointed like that, you may want it this way. So you make your large wire have a space out there, and it can bring the teeth out in the bicuspid area and something like that, instead of just carrying them out this way, which you do with a palatal separator. But you can separate anybody's teeth this way. I don't care. I think you could do it at 90 years old if you wanted to. All right, let's go on to the next wire here. That's just looking at it from the side. But the large wire is piggybacked over. I don't see, yeah, well, here we'll show it. Now here is the small wire was sitting in there going, and when we built this wire, we came out over it. The other would be back in here. You have a space out here where you want the tooth to go, and you bend it where it fits, and it's got this space, and you pull it out, and that comes out to it. Widens the whole thing out. When we get to the end of this, we'll show you, compare it to where the models were. Now we had a bridge on this lady, and so we just hooked it up, and you can do this with a bridge. We just bonded this to this bridge, and we're going to widen the whole bridge out. It's just like taking a table and moving it with the legs on it out. So that's hooked onto a bridge. Now here's the arch wire. We got it out there, and we took the big wire off. And on doing adults, you can drop the arch wire way down on here, and you don't even see the bottom wire. You'll see the top wire, but you won't see the bottom wire in doing the adult orthodontics. Now here, we're pulling that back, and we're going to tend to correct the class 2 problem that you've got, get the points going down in there as best we can. And now this is coming on out on both sides. You can see it enlarging that. Now get through, this is the bottom going. Finally we got this little molar out here where it started a while ago, while it was back in here. So we're moving this out. We changed the angle on these teeth up here, and these were going out. We brought them back, and they fit up underneath there. Now, here is the rectangular wire. That's the wire you put this buccal root torque in right here, and that's piggybacked you with the big wire on top. The big wire gives you all the lateral expansion you need, and the rectangular wire makes the expansion go on the roots and didn't just move the crown of the tooth out like this. It brings it out parallel in that shape. All right, here is the case where we started on this lady, and this was 1991, and she was age 60. I wasn't sure about it, but she's age 60 when we started. She has this bridge, and I didn't want to redo the bridge, so I didn't do it. But if I had started, we would have uprighted that tooth and put the roots down here and bring that bridge in. Now we just have to carry the whole bridge out like moving a table. Now here we want to move these teeth forward right here and slide these underneath here. So we're missing the, looks like a 6-year molar in that case, and also over in the other case. Now, and you adjust whatever you're doing with adults, and you do a similar thing that you do with kids, you know, there's young people, and their bone moves too. You can, I guarantee you, I've got so many adults and showing you it has to move that way. Now let's look at 91. And now we look at 93, and you see these roots have moved forward some in here. We've got this one out leaning further in here, and we're bringing the bridge out with the teeth. Just carrying the whole blooming thing out when you go across there. Now here is this. I think this is just about finished right here. We put these teeth down over that bridge and fit that in. Now it's not finished either because we're going to have to straighten this out down on the bottom. So we'll go in there with a light wire and does a lot of work, and we can run the brackets down here like this, and your lips will be up in this area. You don't even see these bottom braces in here when you're doing this. Now we've got that pretty well out. We're rotating a tooth on the adult just like on anybody. We took this bridge, brought it out to some amount that we matches up with the upper arch. Now there's the big daddy Archwire on piggyback on top of the other one, and there's the rectangular wire that brought the roots out. Now that we got them, we can take the big wire off and it holds it out in that fashion. Now the lower arch now where there's crowded teeth is lined up good, and this is out a little. They need to get a little more over jet here to match the teeth up like that, and we got a class 2 elastics pulling on that. All right, here we have finished the case now, and you can see the side. You see this tooth right here is back behind this right there. Now we got it out in front of that, making these teeth fit right down in that. We've got a little overjet and overbite here in the front teeth too. We show it from the front. Now this is widened out here, and you can see that the difference in it here. And you see these lower anterior teeth that were tilted forward. As we brought the lower jaw out, we moved those teeth back, and they're straighter up and down. At one time they were like this, and now we moved them out. We moved the lower jaw out, and you look from this side. This is where this bridge, the bridge was here, like this, and now it's coming out over it, something like that. This is, may have to have the bridge worked on a little bit there, and it fit like that. Here is the upper arch now. Look at the difference in this arch and the difference in this one right here. And this gives you a super good smile. You just see several years after we finished it in here, we carry 96, 91 to 96, but we finished it probably in about 92 and maybe 93, something like that. Now here is the x-rays on it. This is 92. And we have that large wire in there expanding the teeth. And this is, I don't see the date on it, 6. Anyway, she's older now, and we're bringing her on out. Now here is our finished product, looking at this lady. And there is the facial structure after we finish the case. And there are the teeth. Now, you can do this. I don't care if you can do somebody that's 15 or 18 or 21 or 2 or 3. You can do somebody that's 60 or 70, 80, and even up to the 90s if they got teeth. And so she has a beautiful smile now, brought out like that. And there's people that will be happy to pay you a good fee if you can do this to their teeth. So I'm just trying to show you that you can do these things, and I thank you for watching this. This is from the side. The profile's fine. Let me go back and show this, And this is what I'm saying about adult orthodontics. People think that it can't be done, but it can, and we've shown this many cases in the slides that we have for you, showing you how we have expanded adults and doing cases, everything in there. So thank you for watching, and I'm going to sign out now, and I hope you'll watch our program and subscribe to our channel. Thank you now. Bye-bye.